Hi, everyone. Welcome and thank you for joining. I'm just going to go over a couple of logistics. Everybody who's joining by computer or phone is going to start on mute. If you have any questions, you can feel free to type them into the chat box or into the question and answer section. We're going to be monitoring that throughout this webinar to ensure that no one's questions get lost. And you can also hold on to your questions until the end, and we are going to reserve time for verbal question and answers, so just write down whatever it is that you're thinking of, and we will address it at the end. You'll just raise your hand. That's a feature you can do in Zoom, and I will take you off mute so that you can ask your questions personally. That said, let's begin. So welcome. Thank you for being here. This is the third webinar in PWN's 6-part webinar series on our policy agenda. We're very excited to have some special guests today to talk about ending violence against women and people of trans experience living with HIV. I do want to say that if you missed the previous webinars in our series, it's available on PWN's website, pwn-usa.org. I encourage you to take some time and check those out. We will be having 2 moderators today. We swapped in Nana Khanna, PWN Executive Director for Brianna Diaz, but I am staying the same, Kelly Flannery. I am the If, When, How Reproductive Justice HIV Fellow with Positive Women's Network. And with that, I'll turn it over to
Great. Thanks so much, Kelly. And thanks to our fabulous presenters and to all of our participants for joining today. So yeah, I'm trying to step into Brianna's shoes because she's not feeling well today, which is a pretty tall order. So bear with me. I will be monitoring the chat box and also kind of moderating the Q&A. So feel free to put any questions in the chat throughout. So I'm so excited to be introducing you all today to our fabulous panelists, list of panelists. For those who don't know, I'm the Executive Director of Positive Women's Network USA. We're a national membership body of women and folks with trans experience living with HIV. I come to this work as a woman living with HIV. And I think we'll probably talk more about the PWN later. Our presenters today are really a fierce and powerful lineup, and we're so looking forward to hearing from them. So starting with Vanita Ray, who is the Deputy Director at Positive Women's Network USA. Vanita brings more than 20 years of experience working in underserved communities on a range of social justice issues, from affordable housing to environmental justice, healthcare, and HIV. And she is a speaker and trainer locally and nationally on issues impacting the HIV community. And in fact, today she's actually leading a training. So Vanita is going to be doing her presentation and then she has to hop off. But we will do our best to manage any questions directed to her later on in the webinar. And next we have Renee Ropel. Renee is a gender-free New Yorker-Rican advocating for intentional mental resilience and well-being for TGNC and non-binary folks, so trans and gender non-conforming and non-binary folks. And currently Renee is the manager of the clinical program at the New York City Anti-Violence Project, as well as a at the Ackerman Institute and Family, and for Bronx Gender Equity Wellness Advisory Board. And if that wasn't enough, they also have a private practice working from a health equity framework. And then finally, we have Kate Diadamo, who it's really great to see you again, Kate. We've worked with Kate over the years. Kate is a longtime sex worker rights advocate with a focus on economic justice, anti-policing and incarceration, and public health. And previously, Kate was the national policy advocate at the Sex Workers Project at the Urban Justice Center, where her work focused on laws, policies, and advocacy for folks who trade sex, including criminalization of sex work, anti-trafficking policies, and HIV-specific laws. And before her work at Sex Workers Project, Kate was a community organizer and advocate with SWAP, Sex Workers Outreach Project, as well as Sex Workers Action New York. So I think, thank you. So Positive Women's Network is a national membership body of women and folks of trans experience living with HIV, as well as our allies. And we're basically here to strengthen the strategic power of all women living with HIV in the United States. We've been around since 2008. We were founded by a diverse range of women and folks of trans experience living with HIV, and we are a constituency-led organization. So probably like many of you, after the 2016 election, PWN went through an intensive process of kind of reflection, looking at the political and cultural moment we were in. And part of what that led us to was, in addition to, kind of working on a whole new strategic plan, was a proactive effort to update our policy priorities. And so we took a ton of input from our members. We did a member survey, we did listening sessions with PWN's membership, and we really kind of looked at the emerging issues that our constituency was saying was most impacting their ability to live full, healthy lives with dignity and with bodily autonomy. And we thought about, kind of what did we need to do? We had previously been in a really different political moment with the previous administration in terms of HIV policy. And so while we had been fighting hard, since 2008 to maintain policies that protect our survival and to expand human rights, we knew that it was important to do more than hold the line, and that we needed to think forward and beyond what might seem politically possible to really vision the world we wanted to create and the steps we were going to take to get there through our policy work. And so through that process of reflection and evaluation, we released a new intersectional policy agenda in the summer of 2018 with 6 sort of large framing priority areas. One is ending criminalization, the second is universal health care, thirdly, economic justice, fourthly, sexual and reproductive health rights and justice, ending violence against women living with HIV, and trans rights, safety, and justice. And so our intent in all of these was to, not only protect what we have, but really where necessary to think about what transformative campaigns look like under each of these priority areas. And when I say transformative campaigns, I mean campaigns that redistribute power away from the systems that have not served us and which are actively harming our communities. So visioning alternatives to what is there, thinking both from kind of like a reform and a revolution perspective. And so another thing that we did is we really thought about where can we have the most impact. It's not always at the federal level. Some of the work we need to do is really at a state and local level. And so we sort of refocus some of our efforts towards supporting on-the-ground campaigns. And so in this webinar series, we are introducing our base to each of these 6 areas of priorities with some framing content around how we're thinking about them. There are a ton of materials about this all available on our website if you click on this link for the full policy agenda. Each of these policy priorities has a list of, has a description of sort of like framing, background, as well as links to resources, some of which we have been creating. And so on each of these webinars, we basically do a deep dive with experts in the field to provide you with the context and information you need as advocates to engage on these issues with grounding in racial justice, gender justice, and reproductive justice.
Okay, and so for this webinar, we have 3 main objectives. The first is to increase understanding of the relationship between interpersonal violence and structural violence. The second is to learn how criminalization and policing create conditions for interpersonal violence. And the third is that organizing work. So we're going to highlight some policy solutions and actions that you can take. Right, so let's get to it. First, you can see PWN's vision up on the screen. We know that women and trans and gender nonconforming folks living with HIV are likely to experience intimate partner violence. In fact, one study found that 55% of women living with HIV in the US have experienced intimate partner violence, and over 60% have experienced sexual abuse. A report released by Positively Trans documents that over 40% of transgender people have reported physical violence for the sole reason of being trans, and transgender people of color report even higher rates of physical violence. Other factors like participation in sex work increase the risk of interpersonal violence for transgender people, with 65% of trans women participating in sex work in Washington, D.C., reporting violence from both customers and police. It's a vicious circle. Women and trans and gender nonconforming people in violent relationships are at a higher risk for HIV, and the same folks who are living with HIV are at greater risk of experiencing violence. But violence doesn't start or end with one person, with individuals. In addition to interpersonal violence, women and people of trans experience living with HIV in the US are disproportionately affected by community and structural violence. So structural violence, that's the ways that social structures like legal, economic, medical, or political systems create and perpetuate inequity, causing preventable suffering. It's often subtle and oftentimes invisible. So you can kind of think of it like an iceberg, right? If the interpersonal violence is the tip, we know that it's built upon a massive unseen, like in this case, we're showing a block of ice, but what that is social structures. So to sort of get some context here, a few examples of structural violence that may affect communities hit hardest by the HIV epidemic in the US are a lack of transgender competent healthcare services, racial profiling by the police, racialized sentencing disparities for crimes, and our immigration system where, among other violences, immigrants who try to report crimes to law enforcement may face threats to their immigration status or the immigration status of their loved ones. We know that many healthcare, service delivery, and law enforcement institutions allegedly in place to protect, actually serve and continually, to protect and serve, have and continue to directly harm our communities and perpetuate further trauma. So preventing or intervening in the epidemic of violence against women and people of trans experience living with HIV at the interpersonal, community, and structural level is critically important. And PWN's policy agenda reflects this priority. So I pulled out a couple of recommendations on the screen, but you'll see all of these on our website, and I do encourage you to go to the website in order to dig into them further. I'm not going to go over them specifically right now because what I would love to do is talk a little bit about the webinar. So with every webinar, we're going to release new fact sheets in order to guide your advocacy and inform people in your community about these issues. Our Ending Violence fact sheet is forthcoming. It's soon going to be available on our website. It's not up there yet, but you should look out for it. Our new fact sheet and this webinar are going to focus on violence, interpersonal and structural, and the need for structural interventions that don't perpetuate violence and trauma. We resist addressing violence against women and people of trans experience by relying on policing, prosecution, punishment, and incarceration. Focusing on locking people up paints individuals as the problem, rather than looking at systems and root problems that have created the conditions for interpersonal violence to thrive in the first place. Things like transphobia, housing insecurity, systemic poverty, and racism. By creating systems that support the health and well-being of all, we can tackle the structural underpinnings that stop many from getting out of dangerous and violent situations in the first place. And what's more, we know that relying on police and legal systems can have devastating consequences on families and communities. So instead, we support policies that prioritize healing, rebuilding community, and changing unjust systems. We take a transformative justice approach in recognizing how unjust systems and institutions relate to violence and take it on an obligation to transform or abolish those systems for the better. So with that sort of brief overview, I am going to now turn it over to Vanita Ray.
Oh, thank you. Can you hear me? Okay, thank you, Kelly and Nana, and welcome everybody. It is really a pleasure and honor to be here to talk about a little bit about some of the work that we've done, or how, you know, it doesn't take 1 million people to create change, and to talk a little bit about how we gathered and organized in Houston after the deaths of 2 women living with HIV to create a shift in a conversation that's gone national and is and because of it, we keep raising up those women's names so that we don't forget why we're here. So next slide. So I'll talk a little bit about women living with HIV. Nana gave some statistics and so did Kelly, but I don't know if you don't know that women living with HIV suffer lifetime sexual assault at 5 times the rate of the general population. They are twice as likely to have experienced intimate partner violence, and women living with HIV experience post-traumatic stress disorder and depression at much higher rates than the general population. And 53% of the trans women of color report having been sexual assaulted, and I think that was alluded to earlier, in their lifetime, and 10% within the past year. So, and 54% reported experiencing some form of violence related to intimate partner relationships. So for women living with HIV and those that are vulnerable, intimate partner violence is pretty prevalent, but not talked about. So next slide. So in 2012, I believe it was, in Texas, and I have to say, I come to this work as a woman living with HIV, and I think, I didn't know if that was mentioned, but in 2012, we had a young woman, Cicely Bolden, who was murdered by a partner after she disclosed her status, and it created national attention, and particularly in Texas and the Dallas community kind of really galvanized around this. And the statement by the person who assaulted Cicely was, you know, he wanted her to pay because she didn't tell him that she had HIV. And so that was the first thing that kind of got my attention, that says, wait a minute, that was wrong. And it instilled a lot of fear in women. And it goes against this idea we're supposed to disclose, but if we disclose, is this potentially what could happen? So next slide. So we started with Cicely Bolden in 2012. She was a 28-year-old beautiful woman with 2 kids, and those kids found her body when they came home from school that day. And luckily, the perpetrator was sentenced to 40 years, but we lost a beautiful spirit, and it raised my awareness around the fact that disclosure could lead to death. Next slide. And then in 2014, we had another Texas woman by the name of Elisha Henson, who was also murdered by a partner after disclosure, a young woman, 30 years old, with 2 kids again. And another woman who happened to be there helped hide her body, so it took a little while for her to be found. And this person took a deal for 40 years. After the death of Elisha Henson, I really just was really incensed that we were being told to disclose, but disclosure was leading to death by women with children, young women, and it became unacceptable. And so a few of us in the Houston area, folks had already galvanized in the Dallas area around Cicely Bolden, but with Elisha Henson's death, some of us in the Houston area began to take action because we thought we needed to do something to raise awareness around this. Next slide. And so what we did was, it started with 2 women living with HIV and 1 ally, and we began writing letters to the district attorney. We contacted the family member and got their permission to use their family member's picture, and told them what we wanted to do was raise awareness around their death, and they gave us permission. So we created templates of letters to the DA that we every meeting we went to, we got people to sign on. I mean, the price of a stamp is we flooded the DA because we did not want them to treat this as a case that might be justified and not see either, in that case, Elisha Henson as a victim and not give justice to her. We went around to, we educated the community about what had happened and created a flash blog of stories around other women who as we got more people involved and educated, others began to tell us about their stories. But the flash blog came when we created the National Day of Action. But we also went to support groups around town. And I used to go around with these 11 by 17 cardstocks that I would get from the dollar store and let them create messages of what they wanted the community to say. And as I shared Elisha Henson's story, and we did kind of a Facebook kind of media campaign around, you know, the messaging around what had happened, and trying to educate people that we were just human beings as well. We happen to be living with HIV. Because of that work and the kind of people who got involved, PWN decided to designate one day, a national day of action to end violence against women with living with HIV. And so in October 23rd, 2014, because of this work that started with 3 women who just couldn't take it anymore, in addition to the Dallas women who had started, you know, because of Cicely Bolden's murder, we began to work every year to bring attention to women living with HIV and the fact that disclosure could lead to death, and how serious intimate partner violence was for women living with HIV. Next slide, please. So these are just some of the signs that people made. Some people weren't okay with showing their faces, and it gave them a way to be involved. I mean, so these folks in this one group that I went to made the signs. They weren't comfortable with their face being shown, but I took those signs everywhere, and people who were comfortable with showing their face might hold up the sign, and then we post that on Facebook. So the signs got made by people living with HIV in support groups who weren't comfortable being out, but had messages that they wanted to say. And then those signs got reused over and over again by others as we kept the attention focused on Elisha Henson and Cicely Bolden. So I thought it was really a labor of love. And next slide. No, you're doing fine. Even during that time, we sought to reach out to our trans sisters, because we knew that they were being murdered at a rate that no one could even, I think, and still today, estimate an accurate number. And I brought this issue to them. We tried to do a sisterhood meeting between cis and trans women, and they too, you know, began to hold up the names of trans women who had been killed, as not only maybe living with HIV, but just living authentically themselves. And so this is one of those meetings. Next slide. So because of that, you know, it's interesting. I might work for PWN now and stuff, but back then I didn't. Nana kind of reached out one day and emailed us or something and said, do you want to get on the phone and talk about what you all are doing? And that talk led to them uploading our materials to the PWN website to give others ideas of a template of a letter you could write, or a template of things you could do if you began to see things happening in your community, women being killed as well. And so this is I guess a meme that we over time developed and used for our day of action that is still in existence, and that has grown from maybe just a couple of cities to I don't even know how many cities across the country do different National Day to End Violence activities. Next slide, please. Is that my last one? And so, so doing that work really educated me about how important this issue was, and how prevalent intimate partner violence is among women living with HIV. And it also motivated us to partner and reach out to domestic violence organizations to partner to do events around that National Day of Action to End Violence with Women. We did that several years in Houston, and are looking for another partner for this year to do that. So even though we felt successful, you know, we brought attention, we felt we got justice for the women. I'm here to just say we're not done yet. You know, we all know, and I'm sure the other speakers will speak to this, and Nana will talk to this, the legal system still doesn't protect women. You know, there's been a lot of change, but we've got a long way to go. there's still a higher incidence of IPV for women living with HIV or those vulnerable to acquiring it. We do know that women living with HIV who are experiencing IPV have worse health outcomes due to stress and other things. And victim people who are experiencing these situations are being blamed for not leaving when there's a lot of times a threat of loss of financial support or a threat of criminal action that is being made against some women who want to get out of these situations, and the loss of financial support or outing of their status. What we here in Houston, and I'm sure in other places, we learned there was just not enough resources for intimate partner violence to meet the needs of folks. We had a personal experience of we were doing an event at a domestic violence event for 1 year, the National Day of Action, and one of our members in this meeting admitted that they were experiencing domestic violence at that moment, broke down then. And even though we're in a domestic violence facility, because they were already, couldn't meet the demand, she was not able to get services. And as a matter of fact, just last year, and this is a true story, I helped relocate her to somewhere else so that she could get away from her abuser and start over. So we know there's still a lot more needs to be done. Gender inequality and other structural violence against women also, perpetuate a kind of structural violence and perpetuate the harm that is inflicted upon women living with HIV and our trans sisters. And I just want to include a couple of statistics and lift up the name of Malaysia Booker, a woman of trans experience who was just murdered in the last couple of days, in this last week in Dallas, Texas, after being attacked previously and now. And it's so interesting because there's a video of her speaking after she was attacked, and she said, well, at least you're not holding a memorial for me. And now we are holding a memorial for her. So some statistics I want you to know about it. In 2018, 25 trans women were killed. 19 of those were Black. And these are estimates. I really don't believe we know all the number. In 2017, 24 trans women of color were killed, and 18 of those were Black. So we know that our trans sisters need better support and protection, as well as all women living with HIV. So I ask you to join us on October 23rd in bringing attention to this issue. It's our day of at least speaking in one voice and one sound, and speaking to the issue and trying to save women. So thank you.
Okay, great. So I'm going to pick up from Vanita's points just for a few minutes. And I think, thank you so much, Vanita, for really grounding us in why we do what we do. Part of, I think, what's so important is that we're really clear that it's not only interpersonal and intimate partner violence that is the problem. There are so many ways in which systems and structures are conspiring together to create the conditions of violence for our communities. And so, so when folks are turning to something like the criminal legal system or the criminal justice system, often it's because they don't know where else to go for healing, for support. And so I'm really looking forward to hearing from some of our speakers later today about that. The work to, do some like narrative change work, like the Day of Action to End Violence Against Women is work of culture. And so like systemic violence is sort of like the biases and prejudices and attitudes and stereotypes that justify violence. So I don't know if you saw in one of Vanita's slides, the headline about Cicely Bolden's murder was a quote from her murderer, Larry Dunn, who said, "She killed me, so I killed her." So these are the attitudes about people living with HIV, right? So he he was basically embodying all of these forms of stigma that legitimated an act of interpersonal violence. But also, there are all these institutions that are literally violent against our communities and that are creating more risk. And so, for example, just yesterday, we saw a proposal come out from the Department of Housing and Urban Development that will create barriers for transgender people to be in homeless shelters, and understanding the rates of like how the rates of poverty, the lack of employment opportunities accessible to people of trans experience for a range of structural reasons, right, around whether their gender identity matches their documents and things like that. Understanding that it is hard for trans folks to get jobs. And so basically this new proposal from HUD would legitimize, would allow shelters to discriminate against people of trans experience, and also in some cases would allow shelters to require that trans women are housed with cisgender men, which we know is literally dangerous to them. And so so these are the kinds of structural interventions that we're talking about, is, you know, pushing back against these types of proposals, because policy and culture work together. So changing hearts, minds, narratives is important, and so is changing these policies. So we can go to the next slide, please. A little bit of the work that PWN has done also from a policy perspective on this issue, and I'll just go over this very briefly, is even before we launched the National Day of Action, we were already working to uplift this issue of trauma and violence as it faces women living with HIV. And let me start by saying, actually, where Vanita left off, you might have seen that intersectionality slide, right? We're very clear that women living with HIV are living at the intersection of multiple forms of oppression in the United States and around the world. And so what I mean specifically is that overwhelmingly, women living with HIV in the United States are Black, brown, low income, of trans experience, and are facing multiple forms of marginalization, social and structural marginalization, right? So if we just understand that irrespective of any personal experience of interpersonal violence, which we heard the rates about earlier, if we just assume that racism is a form of violence, right? White supremacy is violence. Transphobia is violence. Being policed around your welfare check is violence. So if we just start with that analysis, we basically can assume that any woman living with HIV, cis or trans, is coming with a history of trauma and violence, right? So if that is just our starting place, how does that fundamentally shift the way that we deliver services and what we think of as priorities? So, you know, for example, in the first National HIV/AIDS Strategy, which came out in July 2010, we were really disturbed to see that there was no attention to this issue that we knew was facing many of our communities. And so we did a lot of advocacy around it. We created a gender monitoring report card and released it to sort of highlight some of the gaps we saw in the National HIV/AIDS Strategy, specifically demanding that the strategy pay more attention to trauma and violence as they impact people living with HIV, and create systems of care that are trauma informed. Next slide. We've already talked about some of this, but you know, also if we understand in a historical context that folks entering HIV service delivery systems, whether for prevention or care or systems that are auxiliary to that, are walking in often not only with the trauma they've experienced in their lifetimes, but with a legacy of historical trauma from a history of slavery and displacement in this country and genocide, and, you know, stealing people's land. So next slide, please. You can actually go to the last slide of mine. Thank you. So for time, I'm gonna, you know, not talk a lot more about this, but let me just end with a few opportunities. So right now we have sort of like the rebirth of the National HIV/AIDS Strategy in a way, this End the Epidemic plan that has come out from the federal government. one of the things we can all be doing is looking at this national plan and local and state level jurisdictional plans to think about how do trauma and violence indicators get integrated into these plans. That's something that we did in with the National HIV/AIDS Strategy in 2015. It's certainly something that folks can be working on at a local level. We're going to hear more from our presenters about potential solutions. And so I'm going to stop here with just the reminder that, again, trauma and violence is not just individual. And so our interventions never can just be at the individual level. And in fact, quote, intervening at the individual level is usually more harmful to our communities and to families than actually addressing these systems and structures. Thank you. And so with that, I am going to introduce our next speaker. So, the conversation so far has been about how we need to craft some of these individual and structural interventions. As we know, interpersonal violence is only part of the story. So now Kate from Reframe Health and Justice is going to help us understand how structural violence shows up and how it makes our communities more vulnerable, specifically focusing on criminalization of the sex trade.
Thank you guys so much. And thank you for the work that you do. And the way I think that you structure and talk about this issue is really beautiful and really centering on the ways that this conversation really is about, the intersections of these different forms of harm. And so I want to talk a little bit about, next slide, please, sex work and the way that sex work is criminalized. And the way that both creates structural violence and institutional violence, and also really facilitates interpersonal violence. So just to bring everyone onto kind of the same page, when we talk about sex work, it is the commercial exchange of sexual services for money or other benefits like housing, transportation, and other needs. It's a really broad definition. It is just as broad as it sounds and covers a lot of different aspects. And, anyone can be a sex worker, but what we're talking about and the way that I like to kind of frame this issue is that sex work really lives at the intersection of criminalization and economic justice. So for a lot of the things that were already talked about, these forms of marginalization, there's a cost to these things. There is, barring people from traditional jobs, not having protections around being fired because you're trans identified, or because you have a criminal record, or because you're undocumented. You still need housing, you still need food. And so for a lot of folks, sex work is what keeps a roof over people's heads. It's what keeps people clothed and fed. Sex work for so many people is survival, and for a lot of communities, it has been the backbone of survival. And so when we're talking about the criminalization of sex work, we are really talking so much about what it means to criminalize people's ability to access resources on their own terms. Next slide. And because of, this is a really broad industry, it covers a lot of different areas. This is just some of them, everything from, in-person escorting to massage work to porn work. So it is a really, really broad range. And so I'm going to talk about criminalization, which is narrowed and kind of narrowly defined very often through prostitution law. But when we talk about sex work, it is a really multifaceted experience. Next slide. And it covers a huge diversity of experiences. And if you click one more time, thank you. It really, sex work is something that shows up for a lot of different people in a lot of different ways. So first off, it can be formal or informal. So we're talking about everything from being a dancer where you work in a club, or perhaps porn work, which is formal labor, all the way to informal labor. So you find a client, everything's in cash, no one's declaring that for their taxes. That would be a form of informal labor. It can be independent, collective, or for a third party. So if you work independently, you advertise by yourself, you negotiate by yourself, you keep all your money. If you work collectively, you might be working in peer spaces, especially folks that work in public spaces. You might be working alongside a network of people, and that can be for safety. It can be because that's how your community operates. but you can also work where there isn't necessarily power dynamics around management and employee in the same way as others, but it is a really peer collective space. You can also work for a third party, and this is something that kind of, there's a lot of narratives around what it means to work for a third party that we wouldn't apply to any other form of labor. But some people have a manager, they have someone who gets them clients, who negotiates what that looks like, and works for someone the way you would in any other industry. It can also involve a range of physical contact. And so that can be everything from escorting work where you're directly physically interacting with someone sexually, to cam work where you never actually touch the person that you're with. It can be for a range of resources. Sometimes it's currency, but sometimes it's for just basic services. It can be for drugs, and all of those really still fall under that. It is both criminalized and non-criminalized, and I'll talk a little bit in a second about some of that. Also, it can be through an experience of choice. It can be an experience of circumstance that you're trading sex. It can also be an experience of coercion. And what's really important about this is, anything under capitalism, when we're talking about work, it falls along this range. Some people have a lot of options, and they say for a variety of reasons, maybe I'm a primary parent and caregiver, and my schedule is really challenging, and so I need to be able to have whatever hours I want. How many living wage jobs for folks would successfully actually fill that space where you have the ability to really define your schedule? There's a lot of folks with more constrained circumstances where trading sex either as a complement to another way that you meet resources or as a complement to other circumstances in your life, for whatever reason, trading sex is the best option for you. And then there are people who are forced to engage in sex work. And so some of that falls into the lens of trafficking. We're not going to talk about that here today. Please reach out if you have questions. Falls along these. And the most important thing to remember is that as a person's circumstances and options change, they can really move along, from year to year or from day to day or from client to client where they fall on that. Maybe it's the beginning of the month, you are seeing clients regularly. It hits the 15th, you're doing really well. And you say, I don't want to see that client right now. I don't want to take that shift. I don't want to offer that other service. And so I'm going to make that decision. And on the 17th, you hit a pothole and your axle breaks. And all of a sudden you have a $1,000 bill that came out of nowhere, but you still need your car. And all of a sudden that ability to make those choices and to have those options goes away because you really, really need to make that money fast. And that doesn't undermine the choice that you had the day before. And it doesn't undermine the fact that you might have a choice later. And all of those experiences are the ability to engage in fluid labor and informal labor means that, all of these experiences can be true at the same time, and none of them negates any of the others. And finally, as we were talking about, and as we're really centering folks that live at the intersection of these different experiences, yes, everyone can participate in the sex trade. Across gender identities, ages, documentation status, where they are from, religion, there is someone who has traded sex who fits every single identity you will ever come across. And the people who are more likely to participate in informal labor and the sex trade are folks who are marginalized from other ways of meeting their resource needs. And so when we looked at, one of the best surveys out there on this is looking at the Transgender Discrimination Survey. They have the Meaningful Work Report, which looked at respondents and their participation in the sex trade. And 11% of respondents said that they had traded sex for resources. And then when you break that down by race, you have 22% of Asian identified trans folks, you have 33% of Latinx trans folks, and you have 40% of Black trans folks saying that they have traded sex for resources. And so when we're talking about this, we have to recognize that yes, this is a diverse range of experiences, and we have to make sure we are centering folks who are more likely to be experiencing, especially the harm and criminalization that is part of this. Next slide. And so sex workers experience different types of violence. I pull this breakout of violence within communities versus violence against communities from Insight Women of Color Collective. And so, of course, there is, people who trade sex do face interpersonal violence. And so that can be physical and sexual violence from a range of actors. Sexual harassment, so really similar to what was talked about before around stigma. There is very often this interpersonal assumption of, if this is your job, you are more sexually available, and you are someone that I can target for this form of violence. Similarly, exploitation is something that's really prevalent, where people say, I know you don't want to be outed. I know that there are risks to you being outed, and so I'm going to use that stigma and use that threat of harm to exploit you for money or for sexual services. Next slide. And of course, when we talk about criminalization, and I'll go into these in another slide, a little more in depth about the fueling of criminalization and violence, but also, criminalization and stigma is violence against communities. So we can't talk about violence and not talk about the fact that policing and arrest and incarceration are all experiences of violence. Beyond that, especially with service providers, we see denial of care and the experience of reproductive violence coming up for folks, where people go in to access healthcare, and similar to if you're HIV positive, if you're experiencing some other form of that stigma, people say, I'm not going to waste care on you because you don't deserve it. And so we see that with a lot of public health spaces, a lot of abuse from those kind of service providers. Next slide. And so criminalization of the sex trade takes place really at every single level. So first and foremost, the United States is the most criminalized country in the entire global north around the sex trade, where we have prostitution and proxy laws, where the exchange of sexual services for resources is criminalized, both the buyer and the seller. Also criminalized is everyone around that person. And so if you are facilitating or promoting prostitution, which can be, I'm going to drive you to a session because it's way out there. I don't want you to take a cab. I don't want you to take public transit at 2 o'clock in the morning. I'm going to drive you there. You are facilitating prostitution. If your friend's phone got cut off and you post an ad online for them, you are promoting prostitution. And so these laws not only criminalize the person selling and the person buying, but they also criminalize every single person around you who knows and is in support of that. And so you see things like isolation. You see all of these things around cutting off people in your life, cutting off community, not being able to participate in harm reduction techniques because you recognize that that puts someone in a precarious position around the law. In terms of civil and administrative law, so in civil situations, you see things like the removal of children because they say you're not a good care provider, and so Child Protective Services will come in and you'll lose custody. Housing laws, this comes up a lot, where people will be working out of their space, or even where their landlord finds out that they're engaged in sex work and therefore are evicted. Administrative laws cover things like licensing requirements, and then labor laws impact formal areas of the industry. Next slide. And criminalization, we often talk about it as the moment of arrest, but it really begins long before that. So when you are policed for your behavior, so prostitution is illegal, but you still have to advertise if you engage in sex work. And so policing and criminalization sets in long before anyone ever gets arrested, because people's behaviors are changing, and very often to the increase of risk and vulnerability. So there's the policing of sex work where people begin to shift behavior. And so that can be, those direct things where you say, you don't want to be in an area known for prostitution where you know that there are police, so you go somewhere else. Another space can be, another way that happens is the carrying of condoms, where someone will be in an area known for prostitution and possession of condoms can be used against them as a form of evidence, and so you make the decision not to carry condoms. Once there is arrest and incarceration, that is a form of violence. And then there are post-conviction issues as well, which also marginalize people from having access to resources. So it's everything from expensive court fines and fees, the possibility of deportation, and then other things like post-conviction requirements, which are going to negatively impact your life and your ability to access resources. Next slide. And so first and foremost, the thing to remember about criminalization is that when you criminalize a population, you are creating a target population. If you have a population of people who are not necessarily going to go to law enforcement when they are victimized, they are the people that are targeted for victimization. So in policing, having to avoid police means isolation. It means that you cannot reach out to peers around you, because that puts you in danger of policing. The ability to negotiate. So if you're worried that you're involved in a sting operation and you're worried that you might be talking to law enforcement, your negotiation around things like condom use, around things like the use of barriers, all of a sudden goes down, because that can be used against you in court. Like I said, having things like condoms can also put you in a precarious position around arrest. Also, when you're policing the way that someone accesses really basic resources, you're going to make sure that they don't have as many resources. So fewer clients in a highly policed area means less money, but it doesn't mean your rent goes down. And so people, when they are policed, you're more likely to lower your prices, you're more likely to engage in riskier sexual behaviors, you're more likely to take every client you can because you don't necessarily know. And so rates of precarity, or your vulnerability to violence, your vulnerability to HIV and STI transmission goes up. And of course, fewer resources means, you're not able to access, you're not able to meet your resource needs as easily. And finally, and I'm going to wrap it up here, I think stigma and shaming, which has been touched on before, is really an important thing, because it absolutely contributes to so much of this violence. The cornerstone of violence is really dehumanization. And the way that we talk about people who trade sex, people in poverty, people with HIV, is really foundational to, unfortunately, those experiences. So I'm going to leave it there and pass it on. And I'm excited to hear your questions.
Great. Thank you so much, Kate. So we're going to keep it moving to make sure we have enough time for the Q&A and discussion at the end. And just a reminder that you can put your questions in on the chat box. So thanks for that excellent presentation. And now we're going to turn to Renee. We've been hearing about the interplay of interpersonal and structural violence. And so there's a real challenge here, right? How do we support survivors and also keep our communities free of violence without relying on these institutions that do us further harm? And so Renee is going to talk about some of the work they've been doing with the New York City Anti-Violence Project that grapples with this very question.
Sorry, I'm just going to...
We're just resharing the slides. Sorry. One sec. Please hold. There we go.
Thank you so much, Nana and Kelly, and thank you so much to the PWN for creating these spaces, and for the other fabulous panelists for doing this work, for advocating for survivors of violence. This is like a really beautiful conversation that's happening here, and a much needed conversation to center survivors of violence and also talk about how systems are that are created to help ultimately don't position survivors at the center of the work that they're doing, right? And can re-traumatize survivors, right? And so that's what I'm going to be talking a little bit about, and that's what the New York City Anti-Violence Project does. Next slide. So I just wanted to talk about the work that we do. So NYC AVP, which houses the National Coalition of Anti-Violence Partners, envisions a world where LGBTQ and HIV-affected folks are free from violence. I'm going to be using HIV-affected a lot because we're including space for folks who may not yet know their HIV status for various reasons, or for folks who may be experiencing violence for their perceived HIV status. If folks have a better word for that, we've been grappling with this as well, so please send me something in the chat box, that would be awesome. Next slide. This is a bunch of stuff that we do. We do a lot of stuff. All of it's free. So we provide free counseling, advocacy, legal, and community organizing and outreach services to folks. We also have a 24/7 bilingual English-Spanish hotline for survivors of violence. In the interest of time, I'm just going to keep things pushing. Next slide. And this is the framework from which we operate. So we talk a lot about the 4 I's of oppression and how this works not only within our organization, but how we're working to support survivors, right? And so how these interpersonal interactions that we're trying very consciously to be aware of as not only the positions of power and privilege that we hold when we're supporting clients, and how this is working in terms of the structure that we have created here at NYC ADP, but also the other structures that we are operating within, right? And so as we're thinking of this, right, we're thinking about how these interpersonal interactions create our internal sense of self and well-being, how this fosters continued interpersonal interactions, and how this feeds into the systems that are created, and how this creates the culture, right? Whose culture, and how this is fed throughout history. And I was actually quite touched by Vanita's discussion of the ongoing rampant rate of murders of trans women of color. And actually, we've had a lot of conversations around, there was a recent string of trans women of color who were murdered within the last week or so. And in thinking about this, how this is not part of the institution, right? How this was not talked about, how this was something that was not well known, and how this feeds back into someone's own sense of self-worth, right? If this is not talked about in the media, in the news, what does this say about myself as a trans person of color? I am not worthy, right? I am not worthy enough of note, right? And what does this mean even in death, right? That is a powerful message to send to survivors. And so I say this not only to uphold these folks who we have lost this last week, but also to reinforce the message that even in death, these things are quite powerful. Next slide. Also, what this means is as we're reinforcing these messages, we have to think about who are the folks who are holding privilege to share the messages, who are the folks that hold power in these spaces, right? And this is how we further these systems of oppression, right? These isms, and trying to be mindful of all of the isms that we are holding and all of the isms that we may have clients interact with in systems. So thinking about when we are supporting survivors of violence and they're interacting with a myriad of systems and spaces, what are the isms that they may be coming across? Next slide. And these isms then, this is just like how these isms then reinforce the structures, right? And so if these systems are created without or purposely excluding specifically trans, non-binary, and gender non-conforming folks and HIV-affected folks, even if these systems are intended to help, they may actually be harming, right? Whether intentionally or unintentionally be harming folks. Because a system without folks present will inevitably harm. Next slide. So this slide is quite busy, and I'm going to pause for a moment to take a look at it. But it's also important to think about how not only in interpersonal relationships are we reinforcing power and control, right? Who has power over, and this is important to consider, and who has the control in interpersonal relationships, but how this can then play out in systems and in larger institutions, and who is holding power over, right? Like when we're interacting with a court system or a legal system, who has power over, and the police, who has power over, right? And who in a hospital system, right? Who is writing the prescription and who has power over. And so I think it's important to consider then who has that power over and what isms are they coming to the table with. And how does that play out, right? And then how does that specifically play out when we're trying to support LGBTQ folks, specifically trans and non-binary folks and HIV affected folks? And this can play out in terms of fears of being outed or coming out and violations of privacy. We see this in systems all the time when folks have concerns about their safety and their identity or their healthcare information. A valid lack of trust in law enforcement, which is constantly being reinforced by not only what they are seeing on social media and in public spaces, but what they are experiencing moving through their communities. Fear of re-victimization, stigmatization, discrimination and retaliation, right? From providers, from support systems, a fear of false arrest or no response at all, and we will talk about that in a minute. That providers may not be competent or that they may need to be re-educated, right? And so that the burden then falls back on survivors to then re-educate, right? And so this sort of re-education, right, by survivors, and then shame and blame, right? And so when we're talking about a legal system or a police system that says, but why did they attack you? And the impetus is actually someone's identity, right? And that is what the legal system is getting at. And then this is creating internalized homophobia, transphobia, right? Or experiencing violence all over again, right? And so communities that are underrepresented, communities that are marginalized, the expectation then is to be remarginalized. And so these helping systems may actually, however good intentioned, may also cause more harm, right? Next slide. So I wanted to parse out like 3 particular systems that we often turn to for help, or we often refer communities to for help, in thinking that they may be supportive, right? Which oftentimes re-victimize or re-traumatize folks or cause new forms of harm. And so in thinking about the hospital system, particularly for trans and gender nonconforming and non-binary folks, this is from the National Trans Discrimination Survey. 19% were just outright refused care because of their trans identity. And 50% of those folks who were even able to get to their doctors had to teach their doctors how to provide care to them, right? So these are mechanisms of power and control, right? Who is allowed to receive care? What type of care or how good is that care allowed to be? Of those folks who were teaching their doctors how to provide care to them, 45% of trans folks report not being tested for HIV, right? So their doctors didn't know enough to test them for HIV, right? And it's not a wonder that 28% of folks just postpone medical care for fear of re-victimization, for fear of traumatization, right? It's important to note that three-fourths of Black respondents postpone care, right? And so these compounding layers of trauma, right, or fears of victimization are important to note. And it is thunderstorming quite bad here. That was quite the thunder. As I talk about the police, that was ominous. Well, so about a fifth of appropriate, yes. So about a fifth of trans folks report being harassed by the police from the same survey, and 38% of Black trans folks report being harassed by the police. And I do think it's important to talk about how multiple layers of identities create harassment, create re-victimization, or create another layer of victimization, right? So the National Coalition of Anti-Violence Partners also looks at how folks are experiencing violence, and also the police response to violence. And in looking at how the police respond to violence, 35% of LGBTQ folks say the police were just indifferent. 31% say the police were downright hostile. This is talking about LGBTQ folks in general. And so it makes a lot of sense that when we're looking at the legal and immigration system, trans women of color died recently in ICE detention because she was withheld her HIV medication, right? And so these are a lot of layers of power and control, right? Who is allowed to have power? Who is allowed to have access, right? Next slide. So what you're looking at here is our survey of how we support folks when they're calling us, right? And they're calling our hotline and they're saying, I have experienced violence and I want advocacy and I want support. We provide them with safety planning and option clarification. We talk to them about what their options might look like. And in talking to them about the different ways they can support themselves, we do offer systems that they can work within to report violence, or different systems that they can go to. But what I think is important to note is out of these systems, the biggest way that folks want support is what we call safety planning, right? So a mechanism outside of systems, right? And so when we default to, why don't you just call 911, the police, go to the hospital, right? A lot of these things that involve these sort of capitalistic, white, patriarchal systems that we have created, clients are coming to us being very aware that participating in these systems, again, may very well end up involve experiencing trauma again, or a different type of trauma. And so this is some of what we do here and some of what I'm going to talk about. Next slide. So I'm going to call this, we call this safety planning and option clarification. And I'm going to talk about it in 3 different ways, between you and your client, for your client outside of systems, and then sort of holding systems accountable. Next slide. So between you and your client, so clients are not required to trust you, and they probably won't, and frankly, nor should they, right? Because what that means is they are using their informed knowledge of the world and utilizing that knowledge and paying it forward, right? So that means that's kind of strengths-based, right? They're pretty smart, and they're smart folks who are using what they've learned. So respect their process and hold space for that, right? It may take some time, and that is completely fine, respecting identities and disclosure, and also very much respecting confidentiality. You have just shared this with me. Is it okay to share it with somebody else? Is it okay to share it with the person at the front desk or the person down the hall, right? Also, we talk a lot about privilege. We talk a lot about the privileges we hold and the identities we hold. This is identity-based work, and it's important to own those things when interacting with folks, because clients are very much aware of those things, right? And also highlighting and utilizing clients' strengths, right? Remembering clients that got to your door, and that's a phenomenal act that clients even showed up, right? I also think it's important to highlight that, like, typically, we are not the first person that clients have called, nor are we like the second or third or fourth. And so holding that for them. Next slide. Utilizing clients' already structured support systems. So here at AVP, we also have our community outreach department, which does a fabulous job of connecting survivors and building support systems of survivors, and I can talk more about that. We also provide option clarification. So here are things within and outside of systems. Let's weigh the costs and benefits, right? Let's talk through what it's going to look like to outreach police, medical providers, other systems and structures, doing some expectation management. How long is this going to take? Who are you going to speak to? How many times you're going to have to speak to them? What documents you're going to provide? How many times you're going to have to out yourself, right? And then setting up systems for harm reduction, which is your opportunity to be very creative with folks. Next slide. My computer might be very delayed. So the other thing is advocating for, on behalf of clients, so a mechanism to intervene on a client's behalf and doing what we call little a advocacy, right? So being able to call systems on a client's behalf and sort of like step in that way, calling a service provider, scheduling an appointment for them, we oftentimes advocate to the police on clients' behalf and have built a relationship with the NYPD here. And then also the big A advocacy. So lobbying, rallying, protesting, all of those good things. I know we're running quite short on time, and so the last piece that I can leave you with is that it's also important to be mindful of the internal work that we need to do, not only for ourselves, but within our agencies, because we are also part of the system, right? And so thinking about not that it's a matter of if we will cause harm, but when we will cause harm to clients, right? Because we also hold our own isms and we need to do the work, right? Like it is definitely a lifestyle choice. It's not a one-off training or a check the box thing. So being mindful of time, that's the last thing. So thank you all very much.
Okay, great. And yeah, there's so much to say about all of this. So thank you so much, Renee and Kate. So if anybody has questions or comments, you can raise your hands and we will unmute you. We'd love to hear from y'all. I know there was one question addressed in the chat box already. And I'm wondering if it would benefit folks to just hear a brief summary of the question and response. So let me just frame the question briefly. So the question was to Kate about the comment about labor laws on the slide about criminalization. And the question was, why are labor laws a problem? How can they intersect with criminalization of sex work and folks in the sex trade? So Kate, do you want to take that?
Sure, and that is absolutely a fantastic question. I am definitely in support of laws that are about, creating a baseline for working conditions, are about, wage and hour support, and are really meant to uplift the experiences of labor and of workers. Where this gets tricky for the sex industry is sometimes more in like administrative law, where there are really high barriers to participate legally in the sex industry. And the reason that turns into criminalization is because when you have things like, so in Atlanta, if you want to dance, you have to go get you have to register on a publicly available registry. You have to get a license that is, I believe, about $400 and not transferable between workplaces. So if you get that for one club, you're sexually harassed there, you have to pay another $400 to get a different license to work at a different club. It is renewable every single year. And in Seattle, they have something like this. And those are huge barriers. So if there are barriers like that, what it means is, especially for folks that are migrants, people experiencing poverty, people who don't want to be on a publicly disclosed registry of sex workers, they're still participating in a criminalized economy. And so it's generally, when you have things like that, re-marginalizing the same folks who are already disproportionately impacted by criminalization. In New York, we have massage without a license, where, that's where laws like that are felonies, actually, where prostitution is a misdemeanor. And so it's still a form of criminalization of the sex industry. It is an excuse for law enforcement to do sting operations and to do raids. And so I'm totally in support of like OSHA and health and safety. I'm in support of things that are developed for and by the people working in that industry and are really thoughtful to the diverse experiences of that industry, without creating additional barriers which end up re-marginalizing people.
Great, thank you so much. While folks are thinking about their questions, I actually have one, picking up on something you were talking about, Renee. You were talking about how institutions are, we can basically assume that like the institution is going to harm people. So what do we do about that? And I'd love to hear your thoughts, any thoughts you have, or New York City Anti-Violence Project has about that, and any specific recommendations.
We oftentimes think of it as a harm reduction model. So I think the first thing is to consider, is to center the client and figure out what the client wants, because oftentimes we're going into it assuming the client does not want to involve systems, and some people are very much pro-reporting to the police, pro-involving legal and law enforcement, when that's typically not the stance that we take. But some folks very much want that. And so centering the survivor, right, and walking them through what their options are, and saying this is one of the many options that we can work through, and also setting realistic expectations of them, right? And so we're not really there to provide necessarily an answer for anyone. So if folks are saying, like, what should I do, or what do I have to do, right? Like, we're not requiring anybody to go and do a rape kit at a hospital, right? That is one option that you have. We want to be realistic about what that looks like. As somebody who holds these identities that you have shared with me, here are some things that could happen. We may be able to support you in accompanying. Could someone go and accompany you? Let's try and mitigate harm if that's something that you would really like to do. If you are able to do this, right? If you are able to follow up and have this done, or would like to have this done, let's strategize and safety plan about what that could look like, if there are other supports that could be offered for you to, like, harm reduce, right? Because, like, really, if we're talking about the system providing harm, then we need to talk about harm reduction from the system.
Yeah, that's great. Thank you so much. Okay, so I don't see any other questions in the chat box, so I'll just keep asking. So I'm wondering if either of you could speak to concrete examples that you've seen of like community level interventions around like calling the cops. Like, are there any strategies that you would like folks to think about or be aware of? Or resources that you can think of? I know that, you know, in Oakland, that's something that we definitely work on with communities, is just sort of like, what are your options? And like, how do we as communities hold each other, instead of like, yes, there could be a, you know, maybe there is a DV situation happening next door. So what are other like possible in the moment kind of interventions for communities that don't rely on the criminal, you know, justice system, which often is so dangerous for folks?
You know, for sex workers, and this is probably a pretty common example that folks might know about, but you know, when you don't have access to those kind of mechanisms, you know, you get creative. And so one of the things that is really common to sex worker communities are things called bad date lists, where if someone has been victimized in a variety of ways, you know, whether it's a sexual or physical violence, or just being stiffed on, you know, non-payment, it is a place where communities have come together to create literally what it says. It's a bad date list. It's a place where you can go and say, this was my experience, this is this client. If they reach out to you, you have a place to screen through. And I think it happens in two different ways. It gets talked about as really a preventative measure, where people, instead of seeing a client who they might be victimized, you're able to say, all right, you have a track record. I am not going to see you anymore, block your number, etc. I know what to look for. So it's looked at prevention, but also, you know, those things are about communities coming together to say, this was my experience, and I'm going to take this to a community of people who understand this experience. I might be able to talk about it with someone in a way that feels really safe. And at the end of the day, I feel seen, and I feel like I'm doing something to contribute to my community feeling safer and the people around me feeling safer. And so it gets you know, lumped into harm reduction, but I think there's a back and forth that often gets left out when people talk about it, where contributing to something is, for a lot of people, a sense of healing, and that sense of justice in a way that is really rare to experience, especially when you're talking very often about something where the in a lot of spaces, you talk about sexual violence as someone who trades sex and get looked at as if you brought it on yourself. Or that, you know, someone tried to take off the condom and we didn't negotiate this and it was really scary and it was really upsetting. And that really gets undermined a lot of times when you report it to places. And so having a space where you can say, this was my experience and it's going to be valid to you as an experience of harm and I get to define it in the way that I want, is a really important piece in and of itself.
Thank you so much for that. I see that we have a question from Judith. Judith, you should be unmuted if you want to ask your question. I'm trying to Judith, you just need to click your mic on your computer to unmute. We've unmuted you from our end. Cool. We can hear you now. Okay, not hearing Judith. Are you speaking? Okay, let me just reiterate then the question that came in the chat box. So the question was, do any of the panelists think addressing substance use is an avenue to empower this population? I'm not sure if I totally understand the question. So Judith, I don't know if you want to clarify in the chat if you're not able to unmute yourself. Okay, maybe we'll come back to that unless any of the panelists are clear about the question. There's another one in the chat box as well.
I will say that I think employing harm reduction and meeting folks where they are around substance use is really honoring and really important. I also really want to acknowledge that substance use is something that can be a really important experience for folks and also should be kind of taken into account as, for some people, it is a coping mechanism. For some people, substance use is an experience of healing, and the way that we have structurally or created structures around substance use are what contributes to the harm that people experience, whether it's criminalization or whether it's compromises to health. And so I think that incorporating substance use as part of someone's experience in the way that honors the way that they approach it is definitely a piece of that. And for something that is also very, very stigmatized, it's honoring that in a harm reduction and in a healing centered way is an incredibly empowering piece, just as is every other identity that is stigmatized, like when you approach it from a space of non-judgment and welcome.
Yeah, I really appreciate that that place, because I'm thinking about when we center folks, it's always important to understand why substance use is happening, because it can come from a variety and for a myriad of reasons, right? And this can be everything from, like, I'm supporting my mental health and in the most cost-effective and time-efficient way I can, which is like quite a strength, to, like, this is something that I'm doing to connect in, like, a spiritual way, and this is coming from, like, a, you know, like a spiritual place, to, like, this is something that is really permeating my life in a destructive and painful way, and there's a lot of pain being initiated, right? And a whole host of reasons in between. And I think it really understanding that place helps, is that empowering space that it maybe is the root of your question, Judith. I don't know if you want to expand on your question a little, if that's helpful for you. But also, if we're talking about folks who have experienced violence, where that substance use is connected to, can be really impactful.
Great, thank you so much to both of you. And I think, you know, above anything, if we start with a trauma-informed lens and kind of like assume that people are brilliant and are already, you know, have survived and are like folks who are coming into any setting, whether they're looking for services or not, are survivors. Our folks are like survivors of lots of different forms of trauma. And so from that lens, I think, we can see substance use in a lot of different ways, from like a survival coping strategy to, as Renee was highlighting, a spiritual experience. So I think there are a lot of stigmatizing narratives about substance use that sometimes inform the way we think of supporting somebody when that may or may not even be what they need. So I think we have one final question, and then we're going to go to hearing, any kind of closing thoughts and recommendations from each of our panelists. So Ames, we actually unmuted you if you want to verbally ask your question, if you're in a good place to do that.
Sure, thank you. And thanks for taking this question. It sort of builds on the last question, which is the way that syringe use is criminalized and how that could uniquely affect trans people living with HIV, whether it's because they have syringes because they are injecting drugs, or whether it's because they're using syringes for silicone, for example, or for testosterone. And given that possession of syringes or shared syringes can enhance penalties under HIV criminalization, that is an additional potential power and control mechanism. And I've been trying to work through what are some safety planning options that we should think about for people in that situation. How to exit the situation, I guess, on their own terms.
Decriminalizing syringe exchange or syringe possession sounds like a really great place to start. But until we get to that place, I think one of the things that has happened quite a bit in New York City, and we're quite fortunate to have, is that everywhere from community healthcare clinics to bookstores can be designated as safe injection and syringe exchange drop-off sites. And so having those places and that community members have been able to share where those locations are, where they can go, where they can inject whatever they need to, right? Whether it's whatever that is, right? In a safe way, and have places to drop off needles and exchange needles has been immensely helpful. There's also been a lot of work done with pharmacies in the state of New York around exchanging needles without question. So that has changed a lot, the rate at which HIV has been passed through needle exchange. And I will say that has just been a helpful lot in terms of supporting folks who use medications that need needles, because insurance laws are awful and folks need needles to use medications. And so supporting folks and being able to access their own healthcare and empower folks in their own healthcare in that way is just an important thing to do. And so that's one less mechanism of control and violence in the healthcare setting. Yeah, thank you for that question. I really appreciate it.
Okay, great. So I think we just would love to close out with any final recommendations that you all want to leave our viewers with about how to address, really this epidemic of structural violence against our communities that just seems to be kind of growing by the day and fueling a lot of other forms of violence on the ground.
I'll go first. I think for me, I work on sex work and sex work decriminalization and destigmatization, but, sex work is special and it isn't. It is a part, if you don't have loitering for the purposes of prostitution, you still have a loitering law. If they're not gonna pick you up for promoting, they might pick you up for something else. And so I think decriminalization is incredibly important, obviously. And I think that it's really important that we also embrace the ideas of divestment from these systems, because you know, every single person breaks on average like 7 laws a day. And so it's not necessarily a question of laws, it's a question of which laws and which bodies are policed. And so divesting from systems of oppression and reinvesting in communities and resources, I hope is the place that are where we all kind of seek to find collective liberation. And thank you so much for PWN for creating this space.
Yeah, I mean, thank you so much. This has been a really wonderful conversation. Thank you to the other panelists and for the questions that were asked. I was thinking, you know, at one point you talked about how locking up individuals was an interpersonal act. And in a number of ways, the things that are so harmful to folks, right? It's talked about, you know, criminalizing substances and criminalizing sex work is criminalizing an individual, right, or an interpersonal act for something that is so systemic. And so in thinking about this conversation, at least my takeaway has been how much we can also shift our focus to these larger systemic conversations, right? How much these isms are impacting our work. And also, I think one of the things we often reinforce as individuals is this is not on them, right? As much as these systems try and create interpersonal burden, which then fuels this sort of internalized shame and blame. It is not on them. The system is working in the way it was designed.
Yeah, absolutely. Thank you so much. And I'm going to turn this back to Kelly, but I just want to really thank our presenters and, you know, just remind folks on that note that Renee just left us on. Yes, the system is working as it was designed. Lots of things have been illegal in this country, lots of things have been legal in this country, right? So like slavery was legal, concentration camps for Japanese Americans were illegal, you know, interracial marriage was illegal. So I think we really need to ask ourselves serious questions about whether the law has ever been designed to be a resource for our communities. And I want to really thank our presenters for offering us some alternative options to think about. I'm going to turn it back to Kelly to close us out.
Yeah, thank you so much. I just want to mirror what Nana said. Thank you, Nana. Thank you, Kate and Renee, so much for this like really meaningful discussion. It's been amazing just to be on and to hear and listen to you all talk. So to close this out, I just want to say on PWN, you can go on PWN's website and see the Ending Violence section of our policy agenda. And there you'll see there's a whole bunch of resources that you can click on in order to dive deeper. And when we do release the fact sheet, we will send it all around. There will be more resources on there. So have a look out if you want to continue learning and continue diving into these topics. And then I hope you mark your calendar. We only have 2 webinars left in our series. I can't believe that we're finally, we're coming to the close. It's crazy. But so we have one on advancing sexual and reproductive health rights and justice, and that's going to be on Thursday, June 20th, same time, same place. And then we have one on advancing trans rights, safety, and justice, and that's going to be on Thursday, August 8th at 12 p.m., so same time, same place. With that, I just would like to say once again, thank you so much. There will be a recording coming out, and I hope everyone has a great day.
Thanks so much, everyone. Take care.
Take care.